Good afternoon and welcome to today's presentation on cytomegalovirus and everything we need to know. On the agenda today, we will be discussing what is cytomegalovirus and its associated risk factors. We will be discussing who is at risk. We will be discussing testing and treatment options, what the timeline for this virus looks like, why we as an organization should be concerned, and how to move forward while protecting the community and ourselves. So to begin, what is cytomegalovirus? Cytomegalovirus, or CMV, is a common virus that lives within the human body. Many people have CMV and don't realize it. It typically remains dormant unless the individual becomes pregnant or immunocompromised, and is related to the viruses that cause chickenpox, herpes simplex, and mononucleosis. CMV spreads through saliva and other forms of bodily fluid contact. Who is most at risk with cytomegalovirus? Those are individuals who are pregnant, their newborn babies, or individuals who are immunocompromised. Women who develop an active CMV infection while pregnant can pass the virus onto their babies, and infant symptoms include a premature birth, low birth weight, jaundice, an enlarged or poor functioning liver, microencephaly, pneumonia, and seizures. For individuals who are immunocompromised, those who are at risk are individuals who have undergone or completed stem cell or organ transplants, or for those with a generally weakened immune system. And those symptoms can include fever, fatigue, sore throat, muscle aches, or for those who are severely immunocompromised, it can affect major organ systems and sometimes lead to death. There are several testing options for patients. A lab is required to test for CMV. For adults who are not pregnant, a blood or saliva test can be done with outpatient lab services. For pregnant women, a PCR and urine test is required, as most CMV seropositive mothers shed CMV in their breast milk, which can result in a false positive CMV test if saliva is used alone. Here we have a timeline of what the infectious window looks like for CMV. Upon contraction, the virus can lay dormant for 3 to 12 weeks, depending on the health status and age of the individual. After the 3 to 12 week incubation period is the infectious period, and this can sometimes last for months, depending on the health of the person. After the infectious period, and depending on how the patient is doing, a prescription of antiviral medications may be required, and this can usually last for 1 to 2 weeks. However, sometimes it can be longer. Once an individual has contracted CMV, it will live in their body forever. So, why is this important and how do we prevent the spread? We should be concerned because due to the dormant nature of the virus, it can spread easily amongst vulnerable populations and can be fatal for those who are most at risk. And there's no effective vaccine to prevent CMV for any patient populations. There's no vaccine for mothers, newborns, or a more vulnerable adult population. So to prevent the spread of CMV, if a woman is pregnant, it is encouraged that they do not share anything by mouth used by children, and should avoid any contact with saliva when kissing children. They should default to kisses on the forehead when the opportunities arrive. Additionally, they should practice proper hand hygiene, especially after interacting with children, as the children have high contents of the virus in their saliva and urine. Additionally, we should limit this possibility for exposure. For staff who are treating CMV, particularly our pediatric providers, when treating patients, particularly infants, remain very cognizant of the fact that you are not to touch or expose yourself as little as possible to the potential spread of the virus, and should be practicing proper sanitation practices. A thorough disinfection whenever treating a patient with the potential of having CMV should be done, and this includes the use of bleach wipes. Thank you for your time. If you have any questions or comments, please let me know.